All right, guys, we're going to switch gears a little bit. We're going to be talking about the cure for medical bill sticker shock. My name's Katie Vahle. On your morning bike ride, perhaps you crash on the tracks and hurt your arm. You go to the urgent care clinic, and no doubt the physician's assistant will put you in a splint and send you off to an orthopedic surgeon. The next day, the orthopod will examine you and probably put you in a sling, sending you home, telling you to come back for a follow-up visit. Wow, what a simple, straightforward interaction with our healthcare system. But have you ever thought about how those services get billed and how that bill arrives in your mail 2 months later? It's anything but simple and straightforward. First off, doctors don't do their own billing. They're smart, they outsource it. And that scenario that I just described to you, there's a complex way to code for it where if the provider applied a cast or a splint, they can charge you for fracture management care. But if you got sent home in a sling with a follow-up visit, then the best practice is to bill you for 2 office visits. There's a $437 delta between that coding decision. Can you read your medical bill and decide if it's right? Your insurance company tries to protect you from these situations, but they have blind spots. They're not in the exam room with you. They're not looking at the doctor notes, and they're certainly not calling you the next day to ask you what happened. Could you have checked out the consumer review sites to spot provider offices who have overzealous billing services? Well, here's a review on Healthy Grades. That below average rating for this doctor's office doesn't exactly jump off the page that you're about to get overbilled. And what if you had gone to an ER? Did you know that the average cost for a visit to the emergency room is now well over a month's rent? A billing error or intentional upcode could have been 5 times as costly. So where do you turn to for help? Your insurance company has blind spots. Your doctor doesn't want anything to do with medical billing. He's no fool. And that HR benefit manager who chose the plan in the first place, I gotta tell you, I don't want to share my personal health information with a coworker. We're paying a lot for health care. Every year it gets more expensive. It's certainly not getting cheaper. A family of 4 now spends $22,000 on their healthcare premiums or in deferred salary if someone else is buying their healthcare. On the healthcare exchanges starting in January, insurance companies are able to sell you health plans with out-of-pocket expenses that max out at $12,500. So it shouldn't surprise any of you that 30% of Americans disputed a medical bill last year. If we're being asked to pay more out-of-pocket for our healthcare, then you better believe we're going to demand higher integrity, accountability, and accuracy for the bills we receive. But guess what? There's help out there. There's an army of medical coders, insurance claims adjusters, and nurses who know all about this stuff. We met a medical coder at an oncology clinic that knows how to bill chemotherapy drugs inside and out. I want her on my side. We think that a consumer who's motivated to manage their healthcare expenses, if we can pair them with one of these experts, the combination will be really powerful, and that's our best protection against runaway healthcare inflation. Creating these two-sided markets where you pair a patient and a billing expert works really well in other industries. Anyone that's booked a room on Airbnb knows exactly what I'm talking about. You see, web-based technology makes these services possible. We think it should be just as easy to manage your healthcare expenses as it is to find a cost-effective ride to the airport using your mobile app. But what should this service look like? Well, I think we should be able to find medical billing advocates online. And I want to securely share my medical bills and EOBs with that billing expert online. Let the billing expert tell me whether or not I'm being overcharged or upcoded. I'd certainly opt into an appeal service where I had an industry insider fighting on my behalf, and I would gladly share 30% of whatever that advocate saved for me. But guess what? This isn't just a theoretical concept. We've built this, and it's working in practice. At copatient.com, we've already vetted 50 or so billing experts and invited 7 of them onto our platform. We've had 1,000 patients register for our service, and those billing experts, they've reviewed 250 sets of medical bills. And the scary thing is they found areas to save money due to billing errors or upcodes or other issues in the majority of cases. When they do resolve the issue, they're saving consumers 50% on average. Those are some big dollars. So the next time, one second, the next time you open up your mail and have that medical bill sticker shock, rest assured, there is an expert out there that knows how to spot that coding error, and more importantly, she knows how to fix it. Thank you.